The World Health Organization has been generous with its praise throughout this pandemic. China, Singapore and Ireland have all received praise for their handling of the coronavirus crisis. Now that a new turning point is in sight, with the infection spread slowing and lockdown measures being gradually lifted, the WHO is promoting the Swedish way of doing things. Sweden represents a future model. If we wish to get back to a society in which we don't have lockdowns, the WHO said. They also praised the way Swedes are trusted to self-regulate. Sweden's hands-off approach to lockdown has certainly been different from that of other countries, from France and Italy to the US and China. Large public gatherings are banned, but restaurants, bars and schools have stayed open, and social distancing is encouraged rather than enforced by police. Trust in the public is high, and so is the public's trust in the strategy. Swedes seem happy with the global attention. Many countries are starting to come around to the Swedish way. But like so many stories of national exceptionalism in this crisis, they don't last that long. Like the UK that at one point was convinced it could avoid strict closures, painting them as unscientific, before eventually doing a U-turn. When looking at all-cause mortality, Sweden has been hit with very high excess deaths since the start of the year, according to the European body monitoring these statistics. In Denmark, they've been low. The counter-argument is that Sweden has accepted more deaths in exchange for trying to achieve group immunity more quickly and protecting its economy from lasting collapse. Several big countries in Europe with stricter lockdowns have suffered more excess deaths and greater economic damage than Sweden, while being more aggressive about halting infections. But they felt they had no other way to relieve their overrun hospitals, a problem that Sweden doesn't have. Sweden's COVID-19 journey hasn't been exceptional. Like other countries, it has experienced a surge of deaths in care homes, where about 1 in 3 virus deaths is estimated to have taken place. Staff is expected to self-regulate, but according to reports, they don't always do so. It was the same for relatives before they were barred from visiting. The Swedes have also had a lack of systematic testing and equipment shortages. Things might have been even worse without Sweden's demographic and cultural defenses. This is a population that does social distancing already in many ways. More than half the country lives in a single-person household. Working from home is common and access to fast broadband is everywhere. But Swedes are becoming increasingly unconcerned about keeping their distance as time goes on, as images of packed restaurants indicate. Public health officials have warned about their behavior. Sweden may very well turn out to be a relative winner of sorts, especially economically. It will probably experience a shorter and less severe slowdown than its European neighbors. That will cheer the lockdown critics, who in March warned at the long-term damage of putting economies in deep freeze. Whether that's much of a win for an economy where trade accounts for 89% of GDP is doubtful. Because we haven't reached the end of this pandemic, we can't say anything for certain. We don't know what's going to happen next. None of us have lived through it yet, and that includes Sweden.